It's 7:26. My name is Chris. Thanks for jamming with us on our Facebook Live. This is my late party, Savage K, Cancer Fighter, featuring the late JD Crutch. It's a mashup. Remix! Gone with the Wind. 7:27, Tuesday, March 23rd. The show's proudly, and I mean proudly, like super proud, East-West Rental, IT&E carrier for all my aircon babies. 647 cool. You know, this weather that we're having the last couple of days, this is what I call the aircon tester, right? Especially depending on the situation of where your house is facing, right? So, for example, my place, it's like cool in the morning, but then in the afternoon, the sun is like coming in through the front sliding window and all that, right? Yeah. Because, you know, it goes, that's how it works, guys. That's how it works. The sun, it goes like that. So it's an aircon tester, right? And carrier, if this weather is testing your aircon and your aircon is failing, guess what? You're one of my people. You are an aircon baby. Okay, call 647 cool. All right, and carrier. They'll keep you cool. You're already cool, but you know what? You could always be cooler. We all could be a little cooler. 647 cool. If you're not a speller, it's 647-2665. But I know all of our listeners can spell cool. Also brought to you by IT&E Cabo Enterprises. Dr. Hoa Nguyen is coming up. He's the Physicians Advisory Group Chair. We've also got Here's to Your Health with the American Medical Center Clinic. Jason handles that. It's a great interview. They've been talking about stretching the last couple segments.
Yeah, so two weeks ago, the doctors over at New Gen Physical Therapy were telling us about how to, young people and student athletes getting back on the court and on the field, how they can keep their bodies in shape and not avoid injury. And last week they were telling us about taking care of Monumco. So really, really good tips.
Yeah, great stuff. Then we're getting Mark Scott of the Guam Guard as they've dropped the vaccination eligibility from 40 to 16. So basically anyone over 16 can now get the vaccine if you haven't got it already. What are you waiting for?
You also need to have parental
consent.
Yeah, consent.
Yeah. Bring a note from your mommy and daddy. Or your guardian, your legal guardian.
Yeah, I believe they have to be present.
Yeah, they got to be present. Okay, so there you go. We'll get Mark on to talk about all that stuff. Coming up here as the Guard is really the execution end of the vaccination effort.
But don't forget, there are private clinics that are available. You want me to read that? Let me just read that list so people know.
Ladies and gentlemen, Sabrina Salas-Mantonani.
Adult Healthcare Clinic, Guam Behavioral Health and Wellness Center, IHP Medical Group, American Medical Center, and I apologize, my computer just went down, so I don't have the list. We'll post the list.
Yeah.
My laptop
let's just knock out Dr. Hoa real quick because we have Dr. Ann, and that's going to be like variant, like a deep dive. Doc, good morning. Unmute. Hi. Good morning, doctor.
Okay, hi guys.
Hey, the doctor is in. All right. Doc, so just AMC, right, where we've lowered the vaccination eligibility to 16 years of age. Are you guys anticipating a big turnout, and what are you seeing on like the appointment end of this? Because we know we're doing UOG Cabo Fieldhouse with the Guard, but then also there are, I believe, over 20 different other sites, clinics, pharmacies where people can get vaccinated. So on the AMC side, what are you guys anticipating today?
Yeah, I think we already have a lot of phone calls already for the walk-in and to get the vaccine. So I'm going to have to make sure there's a meeting this morning that Public Health will release the vaccine to the clinic because there's going to be a lot of demand in the clinic side to get vaccinated. So this week and next week, we'll probably anticipate a lot of demand, a lot of appointments for the vaccination.
Mm-hmm.
So it'd be interesting.
And we know we only got a little time, so just from the Physicians Advisory Group standpoint, this path to half, I know that we're looking at May, 50% of the population being vaccinated to reopen tourism. Doc, pretty ambitious. How doable is it?
It's doable if we have the supply. So hopefully, in April, that we have to supply to finish the second dose and also give the first dose to reach the 50% mark. But again, it's all about supply. We have demand. Just that I know they put in the order for the end of March for April batch, and we get there. I think we will pass more than 50% of the population vaccinated by the end of April. So we doing okay. And we have May and June to go. So hopefully by July that we have enough supply to get us to 70% of the population. So hopefully if we can do that, we have a Liberation Day near normal anyway.
Doc, what else is there left for the Physicians Advisory Group to talk about?
We have to talk about really firm up the plan that we're going to open the island to our incoming passenger that have no quarantine. That process is on the surface, but we have to really tighten up to make sure that we have people to track people.
So, Doc, can you?
There's still a lot of work to do for the opening.
Doc, can you talk about the California variant and the 7 cases that were reported out of the press conference yesterday?
As they release it, you have 7 person that have the California variants, which is about 20% more infective than the current COVID-19 strain. But as you can see, our CAR score is still very low, so there's several factors that can probably contribute to that. Is that the people that are symptomatic that went in to get the test done, they did a very good job of isolate themselves against the community, and so I think that our people learn to do that. So that's a great thing. So they're not going around and we don't see that much spread in the community at all. As you can see, our CAR score is still very low. In the past few days, it's at 0 positive, so it's good. And the hospital is like 1, so we do very well.
And do you are you able to kind of explain the 3 different classifications, I guess, from the CDC on the variant of interest, the variant of concern, and the variant of high consequence? Or
we also got Dr. Ann.
Dr. Ann come on board. I don't want to.
Okay, we'll ask Dr. Ann.
But again, they have 3 in the quarantine and 4 in the community. Those are symptomatic patients. So if but again, it's a process isolation and contact tracing. If they do correctly, they can be, contained pretty well. And again, my head's to the people that get sick and that they isolate themselves, and that's why we don't see any surge in the community on those variants at this point. I think when they continue to do that, to do a quarantine until we have at least people vaccinated and protected. So again, the message to people is that even you vaccinated, I keep telling them that, hey, you still need to use the 3W, and the key role to vaccination is to decrease the severity of the illness and the risk of dying, but doesn't mean that you won't get it. But so still try to protect themselves by get vaccinated, okay, and still keep distance to people. If you feel sick, you still need to get tested if you feel sick.
Okay. Are you aware in any of the discussions you've had with the Physicians Advisory Group that if we achieve this path to half the 50% by May 1 and we change our quarantine protocols, etc., do you know if there's going to be any change in the P Corps or the lifting of the public health emergency declaration?
You know, the last people for, and that's something that currently we don't have the treatment yet. You know, really everything's supportive care for people who have COVID-19. So, you know, we really have to define when we go back to near normal people for and get out the pandemic emergency. You know, we're almost there. I think once that we have the 75% of our island, or 70% of our island vaccinated, you know, then you can comfortably say that, hey, we are see the light, and we probably could talk about back to new normal again, been off the people 4. But we got to get that solid 70% of our island vaccinated, and that's something doable by July. Like I said, President Biden has promised that there's enough vaccine out there for everybody. You know, if they want to have it. So hopefully, again, May, June is a key part for us to push the island to get vaccinated. And the guards do a beautiful job of doing it. And so if we continue to do the same thing we do, then we again be probably the number 1, number 2 spot in the nation for as a safe place to be. And again, I heard percent agree on CDC still not advised to travel to Guam, but I think we continue to do what we do, that level will continue to go down.
So is that probably not until we achieve herd immunity?
You know, right now, if we continue to do what we do, I think the next round of CDC evaluation, we should go down to level 2, at least, you know. So I think that we might meet the criteria already to go down to one more level. So I think that we're going to try to request them again to reevaluate our level in the next 2 weeks or so.
Mm-hmm.
What about the senior centers, Doc?
The senior center, I thought the public health are trying to take care of that with the vaccination. Once they vaccinate, I think it's okay for them to open. I mean, at some point, like I said, we need to have some social distance. And wear the mask, and they should be okay. The school are down now to 3 feet, around 6 feet. So we'll slowly open up as we get vaccinated.
Doc, is the Johnson & Johnson vaccine available at the private clinics?
No, probably not. You know, I think for right now, it's not available at UOG, and you have to, like I say, it's reserved for the homebound to senior center. And if you really want to have it, you have to go through a certain application to make sure that there's a reason why you meet the Johnson & Johnson. Because there's very few of them. You know, I understand that we get less than 2,000 coming in. Again, that be most efficiently used on people that don't have no access to the clinic.
So is there, you know, because people are here on our chat saying that it's for the prisoners and homeless people.
Yeah, I'm not quite sure that the homeless people I agree with, the homebound I agree with, the people that have no access to care I agree with, but no, I didn't make the decision for the prisoner. I mean, this basically you have people in one place already. I don't see why you can go back to do the first dose and then the second dose. I didn't make the decision, but to me, it should be for the homebound, the homeless, and the people who have no access to care. That should be our priority.
Okay.
Right on, Doc.
Yeah.
Thank you.
So, again, get vaccinated. Really highly encouraged. A lot of people are still, not a lot, but quite a few people are still reluctant to have it. From the clinic wise, I ask the provider, physician to make sure you talk to the patient, put everything there on the table, and encourage the patient to have it. Protect them, protect the community, and protect their family. So I highly encourage everyone to get vaccinated.
Doc, just real quick, refresh our memory. What's the window from having COVID to being able to get any of the vaccine shots?
Okay. So if you have the COVID and you turn positive for the test, the recommendation right now is 3 months.
3 months. Okay.
After you have COVID?
After you have COVID, yes.
Okay.
Because technically you're supposed to have immunity somewhat for about 90 days, so about 3 months, and then you can get the vaccine. Can you get it before? Yes, you can. But when if there's ample supply out there, you can get it. But right now, with the shortage, we can comfortably say that you can wait 3 months and let other people that have other priority go ahead of you, because you technically are still protected.
Thank you, Doc.
Okay.
Thanks.
Right on.
You're
Appreciate it.
welcome,
Be
guys.
safe. There you go, Dr. Hoa Nguyen of the Physician